So
Oh,
live
no.
stream started, recording as a backup. Call me if you need to. All right.
Okay,
All
fine.
right, no problem.
Right before we begin, I'm going to read the conduct statement. All
Sandy,
right?
do you want to give date and time?
David should be there. And he said he was once coming and he didn't. If he comes, he'll be just a few minutes late.
Okay. I meant
All right.
today's date and time, just for the record.
Right. Today's date is June 11th, and it is
7:03 p.m.
Oh, okay. First, I'll read the conduct statement, then everyone will introduce themselves. Community Board 11 meetings must be held in a professional and hostile-free environment. The following rules of conduct are applicable to members of the public, Community Board 11, and Community Board 11 staff. Any action or behavior that disrupts or interferes with Community Board 11 business will not be tolerated during any community board meeting and may result in the individuals being asked to leave. If the action or behavior continues, this may be considered disturbing the peace and the appropriate authorities may be summoned. If the meeting is held remotely, the person may be muted or expelled for the remainder. Repeated violation by the same person or group of people may result in further action by the community board. Any public speakers must address the full board or the committee with their concern. Electioneering for a position other than an officer of Community Board 11 is prohibited. Engaging in acts of violence, including threats, are grounds for immediate suspension of the right to attend meetings, pending review by the Ethics and Disciplinary Committee. Respect the equality, diversity, and privacy of all persons by respecting and valuing differences of culture and opinion. Refrain from unpleasant or disparaging remarks and other actions. Abstain from all forms of harassment by actively discouraging it. Disseminating false information is prohibited, and that is our code of conduct. Now I'll go to introduction. I'm sorry that I'm not there, but my back has really been acting up today. I'm Sandra Unger, Committee Chair of the Health and Social Services. Go ahead, Cynthia.
I'm Cynthia Rodriguez. I'm one of the committee members. I'm Allison Modell Robley, and I am a psychologist and a faculty member at the Montefiore Einstein Comprehensive Cancer Center, and I run the BOLD Cancer Wellness Program there.
Thank you.
Sure. I'm Tamika Phillips, and I am with the Alzheimer's Association. I manage all 5 boroughs for fundraising events and a very unique DIY event called The Longest Day.
And you should also mention, Tamika, the motorcycle ride that you're having for Alzheimer's Month. Excuse.
Yes, absolutely. Thank you. So along with all of those fundraising initiatives, what's beautiful about how we fundraise, we have people who do all types of events, from the ride to end Alzheimer's, skate to end Alzheimer's, golf to end Alzheimer's. So it's a slew of all of those events in honor of our.
I know.
Yes.
And I'm bringing it up only because my friend started one for the motorcycle ride the other day. Okay, and the last person to speak.
Hi, good afternoon. My name is Jackie Lopez. I'm also with the Alzheimer's Association. I'm a program manager, so I focus on bringing education to the community and connecting caregivers and I work very closely with Tamika. She manages all 5 boroughs. I work primarily in Brooklyn and the Bronx.
Thank you. All right, who wants to go first? Cynthia, I leave it up to you.
Would you like to start?
I
Sure.
think Dr. Most, no, actually, Tamika and Jackie were the first to apply months ago.
Okay, that's totally fine. You guys can go.
Okay,
So you just start right where you want.
Yeah.
Yeah, we can just talk about the Bronx.
Yeah. So good afternoon, Board 11. Thank you again for the opportunity to be here. Ms. Sandra, thank you for the invitation.
oh,
We
you're
are, can you hear me?
yes, I hear you.
Wonderful. So we're here with the Alzheimer's Association, and we're particularly grateful to be here. June is Alzheimer's and Brain Health Awareness Month, and we're particularly grateful to be here in the Bronx. Something that we've been sharing with every member of our community, not just in the Bronx, but across New York City and across the country, is that here in the Bronx, we are #1 with the highest rates of Alzheimer's in the country. We're tied with Miami-Dade County, and we are also tied with Baltimore County. So we,
Hello?
Sandy, if you can
Hello?
mute your microphone for a second.
All right, how do I do that? What do I press?
Oh, wait, I know you're having some trouble. And I don't think I have host powers. That's okay. Let's, it's fine.
yeah.
All right, we have a
So-
glitch, but we'll work on it.
Yep.
Or we'll work through it. Go ahead.
So again, one of the questions that we often get asked is why is it that the Bronx has the highest rates of Alzheimer's in the country? So New York State as a whole, we're second with the highest rates of Alzheimer's behind California. But New York City in particular, we are leading in the Bronx in particular with the highest rates of Alzheimer's, and it's for a number of different reasons. So we know that Black Americans and Latino Americans were at higher risk for developing Alzheimer's. So we know that in our communities, we have higher rates of heart disease, we have higher rates of diabetes, but that's only one layer as to why we see higher rates. Another thing that we've been talking about in the association, and when Tamika and I go out into our communities to talk about this disease, is the fact that racism within our health systems is still very prevalent. We speak with caregivers and constituents on a daily basis in both of our roles, and I'm saddened, I'm frustrated to share that oftentimes, especially when we're out here in the Bronx, we meet community members who share, I noticed X, Y, and Z, and I brought it up to my provider, but they said I was okay. Or I'm concerned over X, Y, and Z, but they sent me to an appointment, but followed up with me and told me, don't worry, we're going to cancel that. You don't have to follow up. So while at the moment there isn't a cure for Alzheimer's, there are treatments that can help slow down the progression of the disease, but they're only effective when they are taken at the early stages of the disease. So we understand that a lot of people have different approaches in terms of what they want their long-term care to look like, in terms of what they're willing to do treatment-wise. But our biggest goal is to bring education so that our communities know what their options are so that they can make that decision for themselves and that time doesn't make that decision for them. So we do that through a number of different ways. First and foremost, we lead through bringing awareness to this disease. Like Tamika mentioned, the longest day, and I know Tamika will talk on that, but the longest day is a platform where folks can bring awareness to the cause in whichever way they want. So, Ms. Sandra, you mentioned that you have a friend who is doing
Right.
Ride to End Alzheimer's.
Yeah, but, a motorcycle drive, right.
Yeah. So there's a number of different ways that our communities can bring more awareness to what this disease is. And we do that hand in hand with bringing education. Ms. Sandra, we'll make sure to email this over to you so that anyone who attended virtually has access to it. But we brought with us a brochure of the different programs and services that we offer. The biggest thing that we want to just emphasize, and if you can share with the community, is that all the programs and services that we offer are completely free. We offer educational programs so that folks know what's the difference between Alzheimer's, what's the difference between dementia. We have educational programs that are designed to help our family members, our community members know how is it that I communicate with my loved one who's navigating this disease. How do I initiate that conversation? What does a diagnosis look like? What does a prognosis look like? We're here to provide that support. We have virtual support groups. We had one in-person support group in Co-op City here in the Bronx, and our goal is to bring more programs to the Bronx, as we don't want our community to feel that they have to travel outside of the borough to get support, especially when we're fighting numbers like we are here in the Bronx. And again, we offer information through our 800 24/7 helpline. It's an 800 number. The number is 272-3900. It's on the brochure, and Ms. Sandra, I'll make sure to email all of this so that folks that are attending virtually have access to it. But we have dementia care experts that speak over 200 different languages that are there to answer a call, whether it's 3 a.m. or 3 p.m. If someone has a question or concern, they don't know what to do, we encourage folks to give a call to this number. And that's just a tidbit of what we do. I would say the biggest thing is we are really looking to build partnerships here in the Bronx. We have each other's back, and we want to make sure that any caregiver, any community member who's navigating this disease, or they're just noticing some difference with themselves or with a loved one, that they know that they don't have to go through this alone. I'm really passionate about this. My family, we navigated this disease with 2 members of our family, and we didn't know about the Alzheimer's Association until after the passing of our loved one. So we want to make sure that, that our community knows that we're here to provide that support to them. So that's a little bit about our educational programs, and the 24/7 helpline. We do one-on-one sessions with folks. We have support groups where we do educational training for clinicians. We do educational training for faith-based organizations. We do training for first responders. We've been working to connect with the precincts to make sure that officers and first responders are trained. So we're really excited at the opportunity to connect with Community Board 11. Thank you again, Ms. Sandra, for the invitation. So I'm going to pass it on to Tamika, who's going to talk a little bit more about.
I thank you very much. I went 1 second, and I want to remind you, you could bring all the brochures to the health fair, because
on the 23rd. Yes,
on the
ma'am.
23rd, I said it's on the table.
Yep, we'll be there. But I'll make sure to send you a virtual copy too, regardless.
Terrific.
Yeah.
All right. Also, Cynthia, she asked what languages, and I thought that the most prevalent would be English, Spanish, Albanian, and maybe Arabic. What do you think?
I agree.
Those would be about the best 4, right?
Yeah.
So I'm just reminding you again.
Okay.
All right.
Perfect.
Now, thank you.
Thank
And we
you,
look
Ms.
forward to meeting you on the 23rd.
On the 23rd. That's right. So I'm going to go ahead and pass it over to Tamika, who's going to talk a little bit more about the longest stay and a little bit more about the association.
Thank you so much, Jackie. Thank you again, Community Board 11. Thank you, Sandra. Thank you, Cynthia. Thank you, Allison. Thank you so much for your time. It's so well appreciated. Again, I do manage all 5 boroughs for New York City, but it's not, for me, it's not about just the fundraising and gaining the funds. I know where all the money goes. Happy to tell you where it all goes. But what's near and dear to my heart is that I am a Bronx resident. and living in Parkchester. 4 years ago, when I look at what our numbers are for the Bronx, it resonates with me so deeply because my grandmother had this disease. What I find is that our community here in the Bronx, some of us are aware of the behaviors, some of us are aware of the name. You know, some of us can't distinguish the name and the, what dementia means and what Alzheimer's mean. But me being part of this vehicle to educate our community is very, very important to me. So again, when it comes down to the Bronx and it comes down to Brooklyn, where we have Jackie, right? Yeah, we have the highest there as a collective. I stay concentrated there and I try to get my volunteers to go out for other, to the other boroughs. Not that it's not needed there, but it's just where those those heavy concentrations are. So it's a heavy subject, right? But we have to make light of it. So how do we make light of it? I look at what we do here in the Bronx. There are so many educational institutions we have. We have community board meetings. We have bars. We have street festivals. We have churches. We have just people on the sides of the street just talking about what they do. But what hurts my heart is when I'm with my community members and some of my neighbors are saying, Tamika, I didn't even know that the Bronx why isn't it on the news? Or why, where's this information? It is on the news, but oftentimes it's that 30 seconds and it's moved on. And I say, and we come together as a collective and create an event, something where it brings that level of awareness. When people see these purple shirts, something about everyone wearing purple and highlighting what's happening, it's a different fiesta, because then you're able to educate our community on what those behaviors look like. When I think about my grandmother who had this disease, my grandmother's behavior changed. And it wasn't even a matter of the educational level of the family and friends. It's just this behavior was different. What do you do with it? So we all delve into what grandma has taught us, those remedies, but Alzheimer's, unfortunately, is not something we can fix with green tea or chicken soup or some mixture of something. We just try to make the best of what we see, understand it, but then we also cave in because we don't understand the behaviors. So with this platform that I manage, the beautiful thing about it is when I'm looking at someone like my grandma who was just dedicated to going to church, my grandmother never said a curse word. She couldn't even say stupid. And then when this disease took over, F-bombs, S-bombs, all these things started to happen. I'm like, who is this woman? And then she didn't keep herself, like when we wanted to dress her, she did, those behaviors. She was like, no, I'm fine. And sometimes she would be a little belligerent with some of other family members. But who knew? Mm-hmm. August 20th of 2020, it was just me and my grandmother in the room. I don't know how, but the universe said, Tamika, it will be you and grandma, and she will take her last breath. I lost my job during that time. And instead of taking flight and wanting to run, and just my faith was challenged, talking to people was challenging, all of that, because this is someone I knew all my entire life that I thought will be with me forever. I put my fists together and I said, I'm going to get you, Alzheimer's. I don't know how. I'm going to get you. So every time I walk in a room, my passion goes not just through the audience that I'm speaking to, but I hope everything I say resonates so deep that you take it with others, and know that without your voices, we cannot bring this level of awareness. So if there is a place of worship, if there is a local bar, if there is a pizzeria, if there is Starbucks or something on the corner, hey, June and November, those are 2 months where Brain and Alzheimer's Awareness Months happen. So if you feel June is too soon for you to create an event, look at something in November, but bring us out there so that we can speak to the community. Jackie, she, when she's out in the community with me, and there's levels to the workshops that she do with community members, she actually has a layout where you can have those questions. A list of questions, because oftentimes you go to the doctor and our PCPs are not always, they do their best, but they don't recognize the behavior that the caregiver is saying, my mom is not, You know, they say, yeah, and they sometimes equate it to old age. And this is why we're here to say, no. If you notice these behaviors, here's how you phrase the question so that it's listed in their My Chart, you know, and a brain health specialist can say, wait a minute, we need to go in. That could be something we can channel earlier because of these behaviors. So they will then speak to the PCP on how to evaluate the 10-question evaluate, where we have 10 warning signs for everyone, what you can look out for. Then we also have what happens with brain health, the 10 exercises you can do to maintain great brain health. Those are steps. Of course, how our partnership is built, those are the steps that you can take with your PCP. Those are the steps that when you speak to a brain health specialist, they'll be able to have a little bit more detail on what to give people. The beauty right now, because of our fundraising, because of our education and how we are just concentrating right here on our communities, we have these drugs that's out. But just because in those drugs that came out that have been FDA approved from our labs, I have to tell you, I've been with the association for 2 years. They weren't there. So I know our organization is moving in this space. It gives me hope to know that I won't have Alzheimer's. You know, we all will not have this disease because we're moving in a progressive way so that we can just eradicate this disease. So how do we do it? We share our purple. We have our cat. I go to JP Morgan Chase. I go all over and tell people, they'll say, how do I do it? And I say, first, we have Jackie come in and tell you how to be a coworker and caregive. Those two are very hard.
Yes.
And oftentimes your colleagues look and they're like, we understand, we empathize, but they don't understand it. So this is where the workshops come in at, where we can help build, where your coworkers can identify, maybe, wait a minute, Cynthia, wait, you're not, wow, your burden is heavy. You don't have anyone to talk to. The Alzheimer's Association has resources for you. Let's talk about that. Like a little bit beyond what the EAP does in your work environment. And then on those days, we sit there and we create like casual days where in June or in November, you wear purple and you just wear it where people who walk around you, they see the signs, they go, wait, I think someone has this. How can I help? I often tell people the money is going to come. It's going to come, you know, just like years ago, the taboo disease were cancer and HIV. Mm-hmm. Now we have been educated so much with those two diseases that if someone approaches us in the community and say, I have cancer, some things we question innately because of how education was brought to us. We'll say, what stage is it? Mm-hmm. Because in our mind, we know you're supposed to go and get your yearly checks or, you know, like things just happen where. And that's the beauty about when you educate your society. It's the same uphill we're going through right now with Alzheimer's. Oftentimes, Alzheimer's in some individuals we have cases where younger people have been diagnosed with this disease. But guess what happens? They're misdiagnosed. Yeah. Yep. So automatically people say, oh, you know, she's having mental issues or she's having, and again, that's because that's the default without being educated on what else could it be, you know? So we want you all to know that we're just not here to say you're familiar with the name. Call us up. Ask those crazy questions that you think are crazy. If you notice a neighbor, this is sometimes I feel like in our communities, we forget to really be that good neighbor where we can say to the granddaughter, you know what? Hey, Sandra, you strike me as this person that will do this. But you strike me as one that will say, listen,
I was just thinking of someone
different, which that's what we need. That's what community is all about. And we have, so the information that we are leaving here is not only about the longest day. I mean, I have women who go and crochet. They crochet on the longest day. They say, and they put up signs that say the day with the most light is the day we fight. Our motto is the solstice. So oftentimes June, we chose June 21st because that's the longest day. That's the day with the longest light. And it's also June 21st.
It's June 21st.
Yeah, June 21st. But we're in leap year now, so June 20th. Yeah, June 20th. But that's when we try to highlight, you know, that level of awareness as well on that specific day. But because of the prevalence that we have going on in our community, I want us to highlight this year round. I want our numbers to go down. So if it means Morris Park has a festival and you say, I'm not quite sure how the Alzheimer's can get here, what can you do? Even if it means wherever the main thoroughfare is, we put in Alzheimer's information in those stores, you know, along the way where people are walking. I want to educate our community on it. I am sad when I see the numbers because those numbers are so reflective of me because I'm able to say, yeah, grandma lived in the Bronx, you know, and yeah, we kind of knew about the disease, not too much about it, but who's there? And I say my voice will stay loud and proud until our numbers are down. And you can see me at the bus stop. You can see me wherever, but I'm going to talk about this disease until it become on the same level as AIDS and cancer. Does anyone have questions?
No, but I must say, you know, people have to understand that Alzheimer's is not only an old person disease because it's early onset, and that does remain sometimes undetected. And then when it's finally diagnosed, it's a little too late.
That's so true, Sandra. Oftentimes,
Oh, I know, we know.
part of Jackie's initial workshops is she talk about that, and that's one of the questions she asked. And oftentimes, when she asked how many people think Alzheimer's is an aging disease, or old, almost half the room all the time raise their hand. And when she explains it on, you know, through slides and all of that, what it looks like, it changes the entire dynamic, you know, of what it is and how we should not just look at people from the perspective of, oh, she's 80, she's 90, this is what she, no, because there's people who are as young as 52.
Oh,
Is
and
it-
younger.
Yes.
Yeah, I was wondering,
Yeah,
like in
no,
cancer. Sorry. I was just going to saying in cancer that they have early onset cancer now, and they're getting younger and younger at diagnosis. Is that the same with Alzheimer's?
Yes.
That they're getting younger and younger.
Yes, they're getting younger and younger, but there was a study they did where it was one case that stood out, or was it a couple of cases, Jackie, where that young lady had her age was in the 30s?
So there is a specific gene. It's the AOPE4 gene. When people carry this particular gene, they're at greater risk of developing early onset Alzheimer's. I can share that anecdotally. We worked with someone here in the New York City chapter that was diagnosed at 34. But that was a specific case where their parent passed at 45, their grandparent passed at 48. But we are anticipating by so currently there's about 7 million people with Alzheimer's. By 2050, we're expecting 13 million people to develop Alzheimer's. So we're not prepared as a country to.
This is going to be a big crisis.
Yes.
And just something else, if that makes you hold your breath for a minute, I'm going to pull it in a little closer. And Jackie knows where I'm going with this. But just think, every 66 seconds, someone is diagnosed with Alzheimer's. So that means this meeting started at what time?
7:02, 7:03.
Scary.
So that's the scary part about it. And many of them are undiagnosed because what? They just recognize behaviors and say they're going to be all right, or try to work through it until it is to your point, Sandra, it's at the point where you can't give them the drugs that we have for treatment. But again,
I know.
Yeah,
because my girlfriend's sister, you know, she was going through a hard time at work. They were always saying, oh, she's acting this way because of the stress of work, blah, blah, blah. And they always put everything off relating it to work.
Yes.
And now
first thing,
she can't even talk, and she's young. It started in her late middle 50s, maybe even sooner. And it's just sad.
Yeah, and that's why we try to tackle those, larger conglomerates and tell them, hey, let's go in. And I have to tell you, even from the fundraising standpoint, I have received many checks, right? But guess what? Those big checks did not allow me to bring in education. It was more like, I'm supporting the cause. Here's a $150,000 check. And I sit down and say, listen to me. There are people at your organization that are going home. You think that your afterward drinks that you're signing off on is just something because you think it's a stressful week. You have no idea what people are tolerating when they get home. And I'll never forget when this managing director said to me, he looked a little pale, and I looked at him and I said, listen to me. You writing off a check to me just to say you support it and we give you the sponsorship and all that great stuff, you're not doing us any good. I said, you really aren't. I said, because at least tell the company why the check is there, and don't even bring it in closer to you if you're not connected to the cause. Say this is what's happening in New York City. You want to know what happened? Just this month, the beginning of this last week, he called me and he said, guess who has Alzheimer's? And I said, who? He said, my dad.
Oh.
And he said, Tamika, you know what? Everything you said to me resonated. He said, if you only knew I sent my parents to Florida, said that weather isn't right. It's too cold here. He said, and all I kept saying was, now what do I do? So it's different. And I said to him, I said, listen to me. Alzheimer's it's so disrespectful. It does not knock on your door and say, hi, here's what's happening. I said, Alzheimer's shows up and will do unpredictable things. And we hold the shame because our loved ones are doing these things that appear to be normal. And he just looked at me and he says, I need you guys starting next year to come in. And I want to do more this time. So coming here to meet with all of you, I don't want this to stop just here. I want you to invite us again. I want until people start saying, yeah, the Alzheimer's Associations, you know what else is happening? Like, no, you should call them. Like, I want you all to be able to champion the change that we're trying to make in the community. And if it's too light, then what we do, we'll sit down and strategize how we create a fundraiser. You know what I mean? Something to bring that level of awareness. Every vendor, every person in this neighborhood, if we all collectively got them together as you would normally do here and tell them about this disease, and if they say, how can they contribute? Even if their dollars were given, but the shame was sat there, the awareness is a whole nother realm. We can tell them every June, you can donate 10% of your proceeds for the month, but have us bring those flyers in. You know what I mean? Something so people can pick them up. These bracelets, whatever it means to bring awareness. We want to educate our community. So trust me, the money will always be there because I'm about to get choked up.
Are you okay?
She's okay.
Hello?
She's okay, Sandy.
She's taking a breath.
Okay. All right.
Because if education about this disease was given to my family, there wouldn't be the separation that we're going through now. Because one doesn't understand why the caregiver is always there, or the caregiver is not doing enough. It's personal for me. And I want us to be educated so not another grandchild have to sit in a room and watch their grandparent. And we're all grandchildren, all of us. But we can make a change together. Let's get educated about it. Then we can walk. And this disease will be just like cancer and just like HIV/AIDS. It will be behind us. So thank you all for your time.
And thank you. Thank you so much. Does anyone in the gallery, anyone else have a question?
It's Kay Cardona. I don't have any questions. I might need more than 2 minutes though, because I am a healthcare worker.
We'll give you more than 2 minutes. Okay.
Thank you, my love. I am a nurse's aide for over 20 years. I come from nurses that worked with the elderly. And the other doctor that's present that mentioned that special gene, I was actually going to bring that up because I haven't had a patient myself, but I have read of cases where it was like a hereditary form that attacked people in their 30s and they were gone by their 40s. That was one point I wanted to bring up. Another point I wanted to bring up is the areas that were mentioned that have the highest levels of Alzheimer's and dementia showing up. These are all places that have very high concentrations of seniors, anywhere from the age 50 going up. The places in Florida, here in New York. Here in New York, I think we have close to 2 million seniors. I just read the other day. The other thing is, since I've been doing this for so long, when I first used to mention to doctors and other people about other related diseases, medications, nutrition playing a part in people's mental health as they age, they used to look at me like I was nuts, and they were rude and they would dismiss me. And now we have information that actually suggests, hey, there may be a link between diabetes and Alzheimer's or dementia happening at earlier than it should, because if the diabetes is not properly treated, maybe the medications, heart disease, there's kidneys, there's all sorts of related things, and I hope that's part of the education, because not everybody has a background like mine. When they're a caregiver, they may not be aware of these things. Another thing I wanted to bring up is when I mention to people, especially a new patient, their family, about tau strands and amyloid plaques, they look at me like I'm from outer space.
Yeah.
And I try to explain to them, like, how the disease forms, how it might progress. It's just, there needs to be more. I know AARP has been publishing stuff on it, and other scientific the places that do scientific research, but I think the public needs to be more aware of the relation with the tau strands and the amyloid plaques. It might be helpful to people what to look for. And my last point is, as a healthcare worker, I work in people's homes primarily. So if a patient is exhibiting any sort of signs, or if we are just questioning, does this person maybe have Alzheimer's or dementia? I mentioned to people, we can go to the GP, we can go to their nephrologist, any of their doctors, and say that we want them to do the 10-question test and maybe refer us to neurology. I have to explain to them that here in New York, what I have experienced with patients is the waiting time to see a neuropsychologist or a neuropsychiatrist can be several months to get an appointment. By that time, you have several more months of progression, frustrated family members, frustrated patient, frustrated a professional caregiver like myself. We have to do something about making these doctors more available, or maybe convincing people to go into that field of medicine, because for people to have to wait, anywhere from 4 months to close to a year to be evaluated and get a diagnosis it's cruel. It's cruel, and it's just so unfair. I'm sorry, I'll shut up now.
No, Kate, that's fine. I just want to mention first, where are you located?
I'm right up the street from you. I'm in Indian Village, and I work in the Pelham Parkway, Van Nest, Morris Park area.
Okay, so Kate, if possible, just from your standpoint, because we have what's called Ask the Expert series. I'm gonna let Jackie speak a little bit more to that, but just because of your level of expertise, I would love for you to be part of the conversations as a Bronx resident, and your expertise at the forums that we have around the Bronx.
Okay.
Okay, good. Thank you so
Well,
much. Because
hey,
everything is needed.
you could use them at the health fair.
I
I
will
understand George soon.
Yes.
Yes.
We got to plug the health fair.
Yes.
I will be at the health fair. I'm also interviewing for a position at Bronx House to be community leader for this
Right.
area.
That's
So that's another avenue where I'll be mostly working with seniors and stuff, but I won't be providing healthcare because I want to, as a 65-year-old person, I want to burgeon out of that and into something else. But if there's something that I could offer to people in terms of my experience, I'd love to do that too.
Yeah. Thank you, Kay. And to your
Thank you.
point, yeah.
First AARP is out.
So AARP is actually one of our national partners. So we do partner with them to bring information.
They are. I'm sorry. I'm speaking to Jackie as well, everyone. But yeah, so AARP is one of our partners. So the information that they're handling with the community is information that they have gotten from us in training on how we can expand our reach. So I do have us regarding fundraising and exercise. They have the silver sneakers. Is anyone familiar with the silver sneaker? Yeah. So
Yes.
that's part of, that's another initiative that they have. So I just wanted to highlight that. Anytime I hear someone say AARP, that's feedback I have to take to national to say they're definitely doing their job. So I'm gonna let Jackie speak on the other. Yes.
And Kate, to your
All right,
point,
can we give,
oh, go ahead.
why don't we give Dr. Modell a chance now?
Yes.
Oh,
Yes,
wait,
for
let
sure.
Jackie. Oh, yeah, go ahead, Jackie.
I was just gonna say, okay, to your point, our biggest thing is to make all the information, both the clinical information, the scientific information, as accessible to the community as possible. So I myself, I'm not a clinician, but I do give presentations that do focus again on explaining what the amyloid plaque is, what the tau tangles are, what to look out for, what different specialists are. And like you said, Kay, right now the biggest challenge is that the wait time is 6 to 8 months to see a specialist. And what we are doing as an association is we're trying to meet people while they're in that waiting period so they don't feel like they're out in limbo. They're just free falling. That's kind of our goal right now. So thank you.
And if I could just say one other thing before doctors speak is that we do have, there's been some communication with members here of the community board. They're part of the community board. We've had 2 speakers from your board that came to speak to us. So I just even knowing that and knowing that you all still have questions, when I meet with them, I need to say, hey, next time you speak with us, let the community board know.
Thank you.
Thank you.
Thank you.
Well, I just want to say I am here for a purpose, and it was to meet you two. So you guys were amazing. I mean, I've just blown away at these young, amazing, powerful women who are standing up for such an important cause. So I'm so glad. So I have to talk about cancer, which, as Tamika said, is more in the rearview mirror than Alzheimer's. So I'm going to talk a little bit about it, but I also want to propose that we work together.
Absolutely.
So I have some ideas for you guys. So I am a psychologist with a specialty in psycho-oncology. I work at Montefiore and Einstein, and I got into the cancer field because my mother was diagnosed at 31 with breast cancer. She died at 43, so I was 16 when my mom died of breast cancer. So for me, it's personal. So the same thing. And I feel your passion.
Yes.
I was like, I got to do something about it. So I literally have been in this field for 35 years, working on trying to educate people not only about cancer early detection and cancer because of the disparities of patients of color getting diagnosed early and at later stages, but also the fact that there's not enough psychological support, mind-body therapies, and most importantly, peer-to-peer support. And that is a big thing that we do at Montefiore and Einstein in this program that I founded about 14 years ago called the BOLD program. And that's Bronx Oncology Living Daily. And our heartbeat of the program are our BOLD buddies. They are cancer survivors from the Bronx They are mostly seniors, and I am sure they would love to learn about Alzheimer's and be champions. So like we should talk. We have
Yes.
like 40 of them.
Wow, that's beautiful.
They're mostly women of color, Hispanic.
Yes.
They speak multiple languages, you know, African languages. I mean, they can get the word out. So like I'm already saying we have
Yes,
to talk.
we
have
will.
to talk. And
Well,
they'll be
now you
thrilled.
know why. Now you know
Yes,
why I put
yes.
these three together.
I mean, it's, you know, there's no accidents in life. And I just met with our buddies. I meet with them every month. I do a process group, and we were talking, and they, you know, they talk about family members who are dealing with Alzheimer's and dementia. So it's touching their lives. It touched my life a year ago. I lost my mother-in-law to it. So I completely understand. And I mean, you know, this is so exciting that there's, you know, I didn't know all of these resources, and I'm in the medical field, you know. So this is wonderful. I will share the purple message with everybody. Absolutely. And you know, my message to all of you is that I think most of us know somebody who's been diagnosed with cancer if we haven't ourselves. There is support out there. The BOLD program is also free. You can get free counseling, free support groups, all kinds of, you know, yoga and dance fitness and all different things that we do, art classes. Most of them are led by other cancer survivors that are incredible from the Bronx. We say it's from the Bronx for the Bronx. And it's just to make sure people feel that they're not alone, because it is very true that the healthcare system broke a little bit. It wasn't perfect before the pandemic. Now it's really broken. So wait lists are huge. Patients are waiting for specialists in oncology and outside of oncology. So sometimes you need a bigger community, and having a cancer survivor speak with somebody who's just been diagnosed. I just talked to a woman the other day, and she said, I'm so terrified. I've got to have a mastectomy. And all she wanted to do was talk to somebody who's been through it. So these BOLD buddies are so amazing. They not only meet with patients who are newly diagnosed, they go into the community and they do the health fairs and they educate the community, get your, you know, your mammogram, get your pap smear, all of that. They're wonderful. But they also go to the bedside in the hospital and meet with patients who are end of life or advanced stage disease. And not all of them, but some of them, they feel called to that, and they will go and sit with them. And so there's just a lot of support out there. And I mean, you know, obviously Tamika, Jackie, and I are kindred souls because we're doing this from our heart, you know, and I just see it, you know, so we will absolutely work together. I mean, you know, for sure. So I don't, yeah, that's all. I mean, I'm glad I didn't do my slide set and all that. Because the truth is Alzheimer's is a bigger issue that doesn't have as much of a spotlight on it that it needs, because of some of it's shame, as you talked about. And of course, there's shame around cancer too. I mean, we've got patients that won't even tell their family members because of the stigma. But, you know, we have to take that away and tell people this is part of the human journey. We're all going to get hit with something. And it might be Alzheimer's, it might be cancer, it might be both, you know. So that's all I'd like to say. I really thank you for inviting me, Sandy, Sandra, and Community Board 11, Cynthia. This was really an honor and a pleasure. And
thank you.
I learned a lot myself.
And you're going to have a table at the fair also, right? You three should be sitting together.
Yes, I think the BOLD team will be there. So you'll actually meet some of the buddies there.
Oh,
Nice.
Yes, yeah, they're definitely coming. I mean, I don't know who's coming, but we agreed to it, so I know there'll be probably 2 buddies and a staff member. Yeah, so we're excited.
I'll be at the.
Oh, good, awesome.
Oh, that's great.
What's the date of the health fair again?
June 23rd.
The 23rd, June
Beautiful.
23rd. It's a Sunday.
Beautiful. Yeah, no, we will definitely, and we will work together
Yes.
to, you know, bring the message to the Bronx, because actually, to be honest with you, we do a lot of educational workshops and things like that, community conversations around cancer in the Bronx. People get scared, you know, they like cancer. But if we bring, like, listen, not just cancer, we're going to talk about Alzheimer's, like, they get scared about that too, but still, they want to get educated, you know, more than one thing. So that would be a way to kind of bring them in as well.
And we work with so many caregivers that are battling cancer as they're caring for someone with Alzheimer's. So you know, we're providing support from the caregiver aspect, but I think for them to have that support for their journey with cancer would be life changing.
Yes.
Definitely, definitely.
And who knows, we can probably do a mini walk as a fundraiser, you know, where the seniors can say, because oftentimes some seniors say to me, and there was someone I met who was in a wheelchair. She said, Tamika, how can I participate?
Yeah.
I said, oh, it's that simple. I said, it doesn't stop here. And she smiled and she said, thank you. And we were able to do it. It's in Brooklyn, at her residence, her senior residence. They did a fundraiser with everyone in the building who, whether they were in a wheelchair or they were whatever
The
it was,
rollators.
yes,
Yep.
they just strolled around the perimeter of their neighborhood. And to see the purple and people stopping saying, what is that? What's happening? What's going on? People, we had volunteers hand out like information on Alzheimer's. I was like, look how we're raising awareness just from that alone. So who
Yeah.
knows? We can do this with bold.
Definitely.
Yes.
We're thinking about doing a bold fundraising walk, so maybe we can put brands.
Yes.
That would be actually
Yes.
wonderful because then both diseases need a
Yep.
spotlight.
Yes.
So
Yes.
we can absolutely, and the color for cancer, for like general cancer, is
Yes.
lavender.
Oh, I probably
So you got purple and lavender.
Yes.
You know?
Yes.
We can make it work with the t-shirt.
Yes, we can. Yes.
So yeah,
Oh,
All right.
this is
I'm happy.
What-
And I was
Please keep us kind of in the loop
Of
so that we
course.
can kind of,
Yes.
you know, join you, show our
Yes,
faces.
please.
and,
Yes, we
you know,
will.
yes,
Absolutely.
absolutely, yeah.
Yes.
Are there, Cynthia, is there anyone in the gallery who has a question or wants to say anything?
I don't see any hands up right now.
Does anyone know?
All right, so we can go on with some old business then, if our present presenters are finished.
All right.
I have a lot of people signed up. This is for the health fair, and I will, you know, get back to Leon at Bronx House to let him know how many tables. And I want to thank you again for doing the flyer and updating it. And
You're welcome.
hopefully we'll have a big success. And I'm looking forward to it.
Well, Sandy, I
And I
think
keep
Miguel,
reminding people.
I'm sorry. I think Miguel had a hand up. Miguel?
I
Miguel?
do.
Okay.
I just was wondering, where would I find information to, as far as volunteer opportunities with your organization within the Bronx?
Which one?
Which one?
Which organization? Bold or the Alzheimer's? Which one,
Alzheimer's, please.
Miguel?
Sorry.
Right. And they'll have a table at the health fair also.
So I'll have Cynthia put my email address in the chat so everyone will have.
Fantastic. Thank you.
You're welcome. Thank you, Miguel.
And actually, I can also post it on I posted your website on our Facebook page.
Thank you.
So if it's okay with you, I can put your email as well.
I'm already out there.
Okay.
All right.
Right.
And it's also going to be on YouTube, the whole meeting,
Yes.
correct? So
Yes,
it will be out there. And, you know, making them aware again that your presentation is now on YouTube.
Awesome.
Right.
Oh.
So Cynthia, just to check up, David never came. Juanita never got on. Katie didn't get on, nor did Richard.
Rich
of them
did
were-
be.
Oh, okay. And we know Joanne is sick.
Yes.
All right. Well, I thought this was a very, very good meeting, and I'm very happy that we had it and we're getting the word out there.
Yes, definitely, Sandy. Good meeting.
Yes, thank
Yes.
you.
Thank you for bringing us all
Thank
together.
you.
Yay.
I look
Definitely.
forward to seeing all of you on the 23rd.
Yeah, you'll see my team there. I don't know about
Right. Right.
Would you like to adjourn?
Yes, I think so.
Okay.
All right. So
Well-
do we call Jeremy or
I'll call Jeremy, no problem.
right? And what time is it?
7:57
It's
p.m.
7:57. Yeah. I thought it went very well and I'm pleased.
Thank you all for
And
joining us.
Thank you.
Thank you. Good night.
Have a wonderful
Good night.
night.
You too.
So I left brochures on your table. Is that okay?
Yes.
Okay. Well, I'll just-
Yeah, that's fine.